Hello, everyone. I hope you can hear me well. My name is Renata Nowak-Garmer, and I'm the Social Protection and Inclusive Growth Specialist at the UNDP Regional Center in Addis Ababa. But I would like to welcome you to this seminar on behalf of Transform, and the seminar is devoted to the frontline workers on social protection. But before we go into that, let me tell you a few words about Transform. So Transform is an interagency initiative comprising ILO, UNICEF, FAO, WFP, UNDP, and other stakeholders. And it's a training initiative on capacity building initiative on social protection delivered with master trainees from Africa and across Africa. And now I believe there is also a Transform version in the Arab states. I hope that some of the master trainers are in the room. If so, I would like to recognize them and thank them for their continued engagement in the Transform initiative. So and I understand that they also were part of the study, so that's another big thank you to the master trainers today. Transform training is delivered at the national level to national governments and authorities, but also and increasingly at the subnational level, where you will find the people who are actually the ones that interact, that deal with the beneficiaries, so to speak, or the participants or recipients of social protection cash transfers and other services. And surprisingly, I was quite surprised that there is so little written on and research on this topic. And I believe that this study will be absolutely, this exploratory study will be absolutely essential for us to understand how the context and how they work, what kind of categories of frontline workers exist, and so on. It will be a very important insight for our policy and practice in this regard. I think, I'm not sure if the slides are moving, but they should be moving. Great. Let me now give you a sense of the flow for the session. So this is a short introduction from me. Then there will be presentations by the authors of the study, after which we will have a discussion, a panel discussion with some excellent experts to weigh in on this topic, followed by question and answers, and we will close in 1 hour. Please note that the session is recorded, so you should be comfortable with that, as well as you have the group chat to ask any questions during the session and then afterwards as well. So let me now introduce the panel quickly. The authors of the study are Vincent van Helsema, who is the social protection specialist at WFP, and Avanti Bansal, child protection and social policy consultant at UNICEF Ghana. Then we have speakers and discussants. Hugh Salmon, who is the director of Global Social Service Workforce Alliance. Stanfield Michaelo, and I'm sorry if I'm not pronouncing the names correctly, who is the former social protection director in Zambia and is currently an independent consultant. We also have with us, sorry, 1 second, Selvin Nihoma, sorry, the name was covered, who is the CEO of Global Institute for Social Protection and who led the establishment of the SASA in South Africa. We also have Celine Felix with us, who is the social protection specialist at UNICEF headquarters. And last but not least, Judith Sandford, who is the consultant on the PSNP program in Ethiopia for the World Bank. Thanks so much. And with that, I'll give it over to the co-presenters and authors of the study. Thank you.
Thank you, Renata, and greetings to all. So we are here today to present briefly some findings from an exploratory study that Vincent and I have been working on for the past years, focused on the social protection frontline workforce for cash transfer programs in Sub-Saharan Africa. Before we begin, we would just like to state that we put a fair amount of detail into the slides as this session is being recorded, and the presentation will be available later for participants to read at their own leisure. But for sake of time, we'll move through them quickly. Next slide, please. So why are we interested in the social protection frontline workforce? We're seeing an increase in scale-ups and investments in social protection cash transfer programs, most recently in response to the global pandemic, but also in response to escalating humanitarian demands from conflicts and climate change, and broadly also to achieve the Sustainable Development Goals. We're seeing accelerated institutionalization with growing funding domestically in the sector. And many programs are evolving. So, for example, by allowing for delivery of cash and linked services in collaboration with other sectors. Also, programs are trying to make their processes and designs more adaptable and shock responsive. We're seeing an uptake in digital solutions to improve efficiency, yet there is limited attention in national social protection strategies and donor discussions on how this actually affects the frontline workforce. So, as several flagship programs across Sub-Saharan Africa and also other parts of the world rely heavily on paraprofessional and volunteer workforces to carry out their programs, this makes them very critical to any discussion on sustainability, scalability, and adaptability of social protection cash transfer programs. Next slide. So our primary research question is, how is the SP frontline workforce structured in the 10 selected study countries in Africa? What SP functions do they support and what challenges do they face? For this study, we define the social protection frontline workforce as all salaried and unsalaried government and non-governmental workers that directly interface with potential or existing recipients of these programs and their communities, and that perform key functions on program delivery, whether routinely or occasionally. These definitions and the roles we present later have been adapted and tailored from the Global Social Service Workforce Alliance, specifically to emphasize those directly involved in social protection program delivery across sectors. We also know that SP covers a broad range of interventions, but our focus today is on non-contributory cash transfer programs and linked social services. Next slide, please. So we realized that to answer the primary research question, we also had to consider how can the SP frontline workforce be defined within the broader category of the social service workforce, what institutional dimensions are significant, and what considerations and recommendations can guide governments and development actors in better supporting the frontline workforce. To answer these questions, we use experiences from 10 Sub-Saharan African countries that you can see on the screen. These countries were selected for their broad geographic range spanning a good part of the continent and also the range of nascent to mature social protection programs. We did consider other countries too, but ultimately we selected these 10 due to key informants being available in the time frame for the interviews. Next slide, please. So this is an independent and unfunded study that was conducted from 2020 to 2024. The aim was really to explore and better understand the issue to inform future research and programming, given the dearth of discourse in this area. And to do this, we chose to design it as an exploratory study using more of an interpretive research paradigm, which offered us flexibility. The study itself was initiated within the Social Protection Unit at UNICEF Ghana Country Office. However, due to COVID-19 and staff movements, we encountered some challenges and delays. And eventually we were still able to continue the study, but more with an independent character and its adaptability. So between 2020 and 2021, we conducted key informant interviews with SP practitioners and experts across the 10 countries, using to a large extent also the Transform Master Trainer Network for our sample. Then from 2020 to 2023, we also conducted a comprehensive literature review of country program documents, which included legal and policy documents, operational manuals, schemes of service, and JDs where they were available, workforce or capacity assessments. We also looked at institutional framework strategies and reports produced by leading organizations in the sector like the World Bank, UNICEF, ILO, WFP, UNDP, ASEAN, and GSSWA. We also looked at impact evaluations, grey literature, academic literature, and research databases using a set of keywords to optimize our results. The last 2 years, really, we've been working on analyzing the findings, bringing them together in a draft, peer review, and finalization. We have a forthcoming paper to be presented at the SASPEN conference in November 2024 in South Africa. Key challenges we encountered along the way: very limited public data describing how the frontline workforce is engaged and supported, very limited data on their numbers, ratios, and remuneration. There were also gaps in terms of how their roles were envisaged on paper, let's say in operational manuals, and what actually happened in practice. And this is where we relied heavily on our key informants to understand the ground realities and triangulate a bit the information we were getting from different sources. The complexity of institutional and administrative models across country also made the analysis a bit challenging. We acknowledge that in some contexts, private stakeholders and NGOs play a key role in SP service delivery, but these have been excluded from the scope of this study. And finally, and most importantly, really, we lack the perspectives of frontline workers and clients themselves, who we fully recognize as key stakeholders in this discussion, but whom, unfortunately, we could not cover due to lack of resources. Next slide, please. So how do we identify the SP frontline workforce? We had two criteria. We looked at those who were in direct contact with potential or existing cash transfer recipients, and those who perform key functions of these cash transfer programs, whether routinely or occasionally. And with these two criteria, we were able to identify 57 different workforces in the 10 study countries. We looked at what administrative level these workforces were placed, the number of workers in proportions to clients and caseloads, how workers were selected based on what criteria, were they formally contracted, informally engaged, what did they receive as remuneration, if any, what kind of training and supervision was available to them, and what role did they play as part of the cash transfer program, but also beyond cash transfer programs. Next slide, please. So to understand and sort of map the workforce, we used administrative levels in the different countries. So you can see here a table in which Tier 1 reflects workers in closest proximity to the clients and communities. This is broadly the sub-district level. Some countries here have multiple levels within the sub-district, such as Kenya, Ethiopia, and Malawi. The next tier, which is also in contact with clients and communities frequently, is Tier 2, and this is broadly the district level. Beyond this, there's Tier 3, which is the regional or provincial level, and then we have Tier 4, which is the national level. Tier 3 and 4 hardly come in contact with clients. Hence, for this study, we focused on workforces operating within Tiers 2 and 1. And now I hand over to Vincent for the next slide.
So to continue, what functions are we looking at? And to deliver social protection, non-contributory social assistance cash transfers, as well as linked services, these are the 6 that tend to come out. So providing information to beneficiaries or eligible potentially beneficiaries about programs, helping with the identification and the referral and the registration, helping programs to understand needs and conditions, to do delivery, right, to support with actual delivery of cash or complementary services. And then in some cases, case management and referral, grievance complaints management, etc. And in other cases, also a role with monitoring and evaluation and reporting. So in that context, we started identifying, also with the help of some of the grey literature, including the Global Social Service Workforce Alliance, classifications of what these roles can roughly look like. At sort of the most community level, we started seeing groups of collaborators. So these are traditional community leaders, people that provide access, gatekeepers, authenticity, acceptability. Then you started seeing a cadre of volunteers that could be community members, they could be paid or unpaid, but they are starting to move into more specialized functions and with the potential sometimes to move into formalized roles. You have paraprofessionals that have non-degree training that can support professionals in specific sectors like social welfare, health, education, and they might even bridge some of these sectors when it comes to social protection with different forms of remuneration, also often dependent on the institution they're associated with. Then you had more degreed professionals and higher degreed specialists emerging, people that have done a bachelor's degree, a master's, specialized training. And finally, you have groups of administrators, people that work on the back end, could just logistics, coordination, payments, etc., supporting the process, but not necessarily dealing with clients directly in kind of a day-to-day capacity. As an example, right, here are some of the names that popped up. This is not everyone, but we try to simplify it, showing in some of the different countries, what are some of these collaborators, who are some of these volunteers, paraprofessionals and professionals. And one thing that also stuck out is that there were quite a lot of committee structures. So when we started the research, we hadn't focused on that as much, but we saw that there's in many countries a large reliance on volunteer committees to do some of this work. This is adapted from the GSSWA, from regional guidance in the Asia-Pacific region. And we found it's a useful way of looking at what we're going to explain to you, or trying to explain to you here today. So if you look at the tier 1, right, so the community client interface tier, and many countries in Africa where there is a high dependence on non-institutionalized workforces, the lower you get, let's say the closer you get to the community, the more there tends to be an overlap across different sectors. So there might be community health workers in linked sectors, there might be agricultural extensionists, there might be teachers, but then they might overlap with some functions of social work as well as social protection. There might be dedicated social protection volunteers with very specific functions, but they're not necessarily professionalized, trained, paid regularly. And the more you go up in tiers, the more a specialization tends to take place, right? There might still be some overlap or require them to work together, but as you get to kind of the district level and institutionalized programs and services, you have people that are really trained and really focused on their job. The outlier is, of course, where this goes all the way to the tier 1 level, and in the case of our study, that tended up to be mostly South Africa. But you do see that in most countries that are relying on volunteer paraprofessional workforces, the closer to tier 1, the less there was a required specialization, and the more the lines were blurred when it came to the roles and the functions that they have. So some initial observations from our 10 countries is that we saw collaborators in 3 out of 10. We saw volunteers in 8 out of 10, including the committees, paraprofessionals in 5 out of 10, professional specialists and 4 out of 10, and administrators, the clear role of administrator in 2 out of 10. At the tier 1 level, right? So at really the community level. At the tier 2, you saw far more professionals and specialists, often within the social welfare, so the district social welfare department, or if there was a dedicated program for social protection within that program. So some of the key conclusions is, yes, in many of the countries, we saw a heavy reliance on volunteer workforces. I mentioned the exception of South Africa. There is a concentration of formalizations at tier 2. In some countries, formalization processes are attempted or started building on paraprofessional community social workers, or across different sectors with health workers or agriculture workers. So we also saw that, especially, like I said, and we're trying to summarize some of the points from that graph, at that community level, there was a large cross-sectoral nature, particularly if programs also started to have not just a cash delivery function, but more of an integrated approach or a cash plus or a linkages type of approach. One final observation is that some initiatives, donor funded or government funded, would create new workforces that might be relevant for a few districts, or woredas or municipios, whatever country you're in, but they were not necessarily sustained when those programs ended. So there was experiences with different types of workforces, but not necessarily a plan to their assistance. So Avanti, over to you again.
Thank you. So we're going to look at some key challenges on how the workforce is engaged at tier 1 and tier 2. Tier 1, we focus on volunteer and paraprofessionals as they are dominant in this category. So volunteers, we saw that they were usually engaged through informal agreements, or they were elected by community members. Their roles were not well defined vis-a-vis other sectors. So at times they had add-on undocumented roles for linkages. We also noticed that volunteers can sit on multiple committees, limiting their availability, for example, in Malawi. And some countries have started thinking of developing job descriptions for their volunteer committees. In comparison, paraprofessionals tend to be contracted through a hiring process which involved TORs being advertised in interviews, and they tend to be appointed from different sectors. Now, remuneration, which is really a sticky point in this whole paper, so the data here is based on limited data, which has not been consistently available for all workforces within and across contexts. But what we have been able to see from the data that's available is that for volunteers, remuneration can vary from anywhere between $2 to $12, and these figures can change if you adjust them for inflation each year. And they can take the form of either ad hoc or activity-based remuneration, so like a missing lunch allowance, a transport allowance, communication allowance, or they can be tied to a payment cycle. So in some countries, volunteers actually receive the same cash stipend as the recipients of the program. And wherever there is a delay in the payment cycle, their remuneration also gets affected. In some countries, it's a monthly remuneration, but we also, during the time of data collection, for example, we noticed that in Kenya, some volunteers were to receive X amount of money per month, but there were challenges in fund flow, and so this meant that they were working pro bono at the time of data collection. Volunteers also receive in-kind incentives like t-shirts, bicycles, uniforms. In Zimbabwe, they also receive tablets and mobile phones to support with recording of data. And here we already see how digitalization is coming into this tier. In some countries like Ethiopia, they were not compensated. And then wherever you had committee-like structures for volunteers, there is a requirement of an admin cost to help them meet regularly, and this is often inadequate. And there was also a lack of clarity on how the stipends provided to committees would be divided between committee members. Sometimes committees have anywhere between 5 to 15 members. And then we also noted in some of the countries that the quantum of allowances was rather arbitrary and changing. All in all, lack of a dedicated budget to fund this workforce and their work. And this also is somewhat similar for the paraprofessionals. We noticed that their remuneration, although more regular, can range from $20 a month to $160. They can also receive additional incentives. We noticed that the paraprofessional cadres that were focused more on social work with social protection responsibilities, like in Ethiopia and Angola, were largely donor funded. But paraprofessionals that were from the health sector received more regular salaries and incentives, and this cost was more likely to be catered for within the national budget. Next slide, please. So in terms of training, volunteers were more likely to receive informal sensitizations on the job, either by their supervisors, which were often social welfare officers. In Mozambique, we saw that there was some pre-service training offered to volunteers. Paraprofessionals, on the other hand, are more likely to go through more formal standardized training, especially when they come from the health sector. So key takeaways from this piece is really that for volunteers, there's a really high opportunity cost to continue pulling their roles in SP programs when they're not remunerated adequately, and especially when other sectors that also use volunteers, like the health sector, pay and train their workforce better. We also noticed that they tend to occupy multiple roles, sitting on multiple committees or having been volunteers for other programs. So there's some questions there on duplication of resources by different sectors and how we can coordinate them better. And this, of course, can adversely affect the motivation of volunteers and their continuity as stakeholders in the program. And it has direct implications for the sustainability, effectiveness, and reliability of the workforce. Next slide, please. When it comes to tier 2 challenges, again, remember here we have a concentration of more formal roles, professionals and specialists at the district level. We noticed that in 4 out of 10 countries, this role was done, it fell mostly within the social service workforce. In 5 out of 10 countries, this role was carried out by social service workforce and other sectors. South Africa, which has been an outlier throughout the study and the presentation, they had their own dedicated social protection workforce, pulling SP roles under SASA. And we can see that in 9 out of 10 countries, the workforce in tier 2 is straddling both social protection and non-social protection statutory roles, often with SP coming on as an add-on or an undocumented role, affecting their effectiveness with regards to their usual jobs. And then we also noticed that there is a shortage of the number of staff at this level. For example, in Ethiopia, there's a really low number of sub-county officers. In Ghana, 59% staffing gaps were noted within this cadre. Malawi, this went up to 71%. In Zambia, only 800 out of 2,000 required community development assistance positions were filled. And so we're really seeing the tier 1 workforce emerging to support an understaffed and overburdened tier 2 workforce. Another example was Zimbabwe, where there was a low ratio of social workers to children. And in the 1990s, the Child Protection Committee concept came up in response to that. And in around 2011, this CPC structure was then co-opted for delivery of the cash transfer program. And so really all of these challenges come against the backdrop of SP programs looking to really scale up their coverage, and the targets entail exponential increase in some cases by 1 million or more recipients. And really the question here is, are we adequately considering the implications for the workforce? Next slide. So here, Vincent and I will give a bit of a snapshot of some of the numbers. And before I hand over to Vincent, just want to point out that the caveat here was that there was very limited data, right? So either data was not available publicly, or this data was not being collected by programs, or the data that we could find was often outdated, in some cases from over 10 years ago. And really, there was insufficient data and guidance on how to establish a common denominator to calculate ratios for different workforces within the same context and across contexts. So we really relied heavily on our key informants to source our figures. So at best, these figures can be considered as estimates, pending availability of more officially verifiable figures in the future. And Vincent, I hand over to you.
Thanks, Avanti. And I must say, I really miss the sound of airplanes flying over the UNICEF Ghana country office as you're trying to be on webinar. So thanks for the little moment of nostalgia. So like Avanti said, it's a snapshot. We checked all these figures yesterday, but you see different groups, different countries have a higher volunteer reliance. So in Ghana and Mozambique and Zambia, you have quite a large reliance. The 88,000 CWAC members in Zambia, volunteers, so they get $2.50 per payment cycle. But that means they have a relatively low ratio of 1 CWAC member to 68 clients. But somewhere like Ghana, which has a community focal point for each community of LEAP, brings it down to an average of about 1 to 250 clients. Keep in mind, what's not captured here is urban-rural divides, because you'll see a lot more staff being in urban areas. Then if you go to a place like, and then in Ghana, for example, they are paid every payment cycle, so that's $15 per 2 months when the payment takes place. You also have other professionals. So if we stick with Ghana, you've got community health volunteers that are supposed to do some linked services. You have community health officers at the paraprofessional level that are also, besides doing their regular community health work, providing occasional information sessions at payments, as well as helping refer to health insurance. And then at the district level, the social welfare officers are the focal points for the district, 1 per district. But they are part of a broader social welfare force of about 2,500 people in the country. So that's on average 1 social welfare officer or development officer, community development officer per 1,000 clients. Now, for those who work on social welfare, you know that for case management, typically you'd recommend 1 social welfare officer for 10 to 15 clients as a maximum. So that makes it hard for them to do social welfare work. The other important thing to note is that in some countries, Kenya, Ethiopia, you see a lot of the committees, some roles there, but mostly committee structures that are responsible for the triage. Whereas in Ethiopia, the development agencies, quite a lot of them are professionalized under the Ministry of Agriculture with a salary. But there's a high reliance on food security and finance staff. South Africa, high professionalization under SASSA. One important point here is that they have about, according to slightly outdated data, about almost 19,000 permanent posts, of which less than half are actually filled right now. So the question is also what's institutionalized versus what is actually working, and that has to do also with continuity and training and incentives. Whereas social workers are spread across institutions and have different degrees of paraprofessional and professionalization. One of the important things to realize is that there is no standardized tool or method to calculate things like workforce, social protection, workforce size, ratios to clients, standards, remuneration, degrees, right? So this is all collected based on the criteria we described in the study. In some sectors like social welfare, there are very concrete ways to calculate client-worker ratios, but given that the functions are so widely dispersed across different levels, it's hard to do that across the board for Africa. It would be easy to do that in specific countries, but that would require dedicated work at country level. This leads us to kind of the final part of the study, which is around institutionalization, right? How is social protection being institutionalized in Africa? We made a really simple diagram to give you some dimensions. You've got, for example, here on the x-axis, highly centralized programs where all the design decisions and even a lot of the implementation decisions are made at the capital level or really inside an institution, whereas the subnational level is mostly just told what to do and to cooperate without much buy-in. So that's one typology at the end of the spectrum versus the other, which would be where you do see more roles at the community and district level for targeting, for payments, for case management, etc. So that's one spectrum. The other is whether an institution has its own staff all the way from, say, the central level to the subnational and community level structures, or whether it borrows staff from other sectors and other work spheres. And hence that has a different implication for how much you can train the staff, pay the staff, grow the staff's career, and keep them motivated. These are some aspects of institutionalization. We're not going to dwell on these others, but some of the questions, these are markers of institutionalization for social protection that UNDP has also in a publication raised. Legal frameworks, dedicated agency or ministry, whether administrative functions are maturing of a social protection program, and budget allocations. And there are questions you can ask that we've had coming out of the study as we conducted it that, you know, feel free when the webinar ends and you have the recording to just pause and look at them on your own terms. So to kind of head to closing, these are the key takeaways, and we will go through each of them because I think it's important that this is what really came out. So for national systems and programs, we confirmed something that we suspected, which is a high ambiguity of roles, particularly at the subnational level and at the tier 1 level. Generally, weak identification and providing clarification of functions and roles in laws and policies, as well as budgets, right? So if you see a social protection budget, it doesn't necessarily cover the staff costs at the front line to do that. We also saw this mix between institutionalization and approaches to institutionalization versus traditional community-based structures. And sometimes the blending of that can be tricky or complicated in order to have clear roles of who does what. We saw that committees are extremely prominent, right? In many of the countries, you see them popping up. They can have implications for how you design your program, how much do you rely on a committee, are there privacy issues, are there inherent stereotypes that might be built into your design then. But it did also have this aspect of fairness in a community in places where there is maybe lack of presence or trust in the formal institutions. Remuneration and training was discussed as being unsystematic and inadequate. Simply the number is insufficient if you look at the extremely high worker-client ratios. And then there is the piling of responsibilities, particularly as programs mature and become more advanced. And that can risk, has been found in some other studies of some of the people actually on this panel, in a detraction of the ability of statutory roles like social welfare to be performed. If you don't even have money to be a social welfare officer, but you have to now do this cash transfer program, then you are risking the social welfare part of the work. And that is, therefore also hurts other sectors that are important to provide comprehensive support to people. Beneficiaries may suffer inadequate support. There's been some reported cases of frontline workers asking a commission from the cash transfers in order to help even cover their basic expenses. But it also might lead to a lack of trust in national systems, the continuity of seeing cash transfers as a handout rather than an entitlement, simply because you don't have anyone to demand your entitlement from in an effective manner. And technology has come up many times as possibly offering solutions, right? If you can make certain processes faster, cheaper, less labor intensive, then the few people can focus on what they're there to do. But if you also push technology on groups of workforces that are not used to using them, or you design technological systems without truly understanding the interconnectivity of the workforce and the interinstitutional processes, that technology can make things worse. An important point is that program design does matter, right? Coming up with a complex program requires capacity to implement it. You can also look at workforces that already exist, such as agricultural extension forces or education or health, and then potentially tap into those workforces for your program. Again, being careful not to harm those workforces in the process, but program design has a huge implication for the type of workforce you will need. And the final point is maybe a bit of the conclusion of this whole work, which is outlined in the final slide, which we won't go into much detail on, but is that it really needs to be a priority when it comes to developing, conceptualizing, building, maturing your social protection systems, to think about the workforce at all levels, and particularly this frontline paraprofessional volunteer committee level, where things are currently very vague, unfunded, and really in flux. There's some potential implications for international practitioners. Like Avanti said, we looked at all the current major strategies for UN and some donors working on social protection in Africa. The topic of the frontline workforce does not really appear systematically. Right, there's some agencies talk a bit about it, maybe from the child protection perspective. Some are increasingly aware of. We've put some links of some readings at the absolute final slide, but in terms of the strategies and prioritization and budget and specific approaches, there's not much. And we also saw that there's quite a few risks of new initiatives or pilots or humanitarian interventions relying on those structures, adding new dimensions, and then without sustaining them or capturing the things they need to drop doing in order to do these new things. And one of the key points there is that perhaps not every actor in social protection, every international actor supporting government, has the same level of capacity or mandate to support workforce development and strengthening, but at a minimum, doing no harm should be a priority for all those actors. So this is the final slide, which we're not going to read out, but the three kind of main recommendations coming out of the report is that final part, that workforce support needs to be more systematic, done at country level in an intentional way. It needs to feed into the policy advocacy and public finance discourse, especially also the budgets for the subnational and sector-specific level for staffing. And it also requires that there is an enhanced clarification of the role of international actors that are supporting the sector so that they can add based on the different strengths and complementarities. That is the end. These are some interesting readings we found. We've also specified some of the chapters, but I will now pass it on to Avanti. Or is it actually, I think Avanti, you say something, right?
No, just to say that was the end of the presentation, and wanted also to give a shout out to Valentina, who would be co-authoring the final paper with towards the end of this year. So now we move on to the panel, please feel free, as Vincent said, to drop your questions in the Q&A and the chat box. We will try to answer them in writing if we can, and then also later on in the Q&A session after the panel discussion. Vincent, over to you.
Thank you. So I'll ask our panelists to perhaps switch on their cameras if they are willing and able to do so. So we've got, I think, 5 really great people that can speak to this across Africa, but even beyond. And we're going to ask, and I'm going to place myself in the role of moderator here, to have each of you speak for just 3 minutes max about what some of the lessons are coming out of this for, from the perspective from where you sit. What are some of your key takeaways? What are some things you might want to add or address and leave the audience with? So I see that I was going to start with either Selwyn or Stanfield. Stanfield, you have your mic open, so I think that automatically makes you the person we start with.
Did you say me, Vincent?
Or, well, I said
Sorry.
Stanfield. But Selwyn, go ahead, actually, go ahead.
Oh no, come on, let the person who had his mic on, Vince.
Well, you spoke, so.
All right. I think no, this paper came really as an interesting document because it's something that I have been thinking over a period of years, I should say. When we started in South Africa a reform, and you'll recall our democratization process with Nelson Mandela's release, we had to reform the system. So we had a big social security system, but pretty much broken. And the fact that you've now looked at already the new developments across the African continent and the expansion of grants shows that you've had quite good foresight that this is going to become a big issue. I've had the benefit, of course, as I said, in many different jurisdictions. Ghana is one of them. Nigeria, when we started Uganda, an interesting experience. But one realized that the staff you had at the beginning is going to be insufficient. They're going to grow, but you will also need other skills. But we're also talking about something of a moving goalpost because of the complexity that is stepped into in the middle of the process of digitization and digitalization, and more recently, of course, AI into it. So it's going to change quite a lot of things. Your paper, again, raises the risk factors, and whichever way one puts it, and this is an estimate that at least in most social protection systems, and people would not want to believe it, but we did a study in South Africa, 10 to 20% of the budget actually gets lost as a result of inclusion and exclusion results. And if you don't have a workforce at the forefront that has the capacity and the competencies, then your system is in effect quite inefficient in addition to other challenges in it. And I think the final initial point I'd like to make is that your paper really is a call to action from those of us in the sector, and the need for what you coin as workforce planning, but a real strategic workforce development should be considered at this juncture, bearing in mind that the different countries are at different phases of development. And again, it would give thought to those who want to support it. Let me rest there.
Yeah, thank you. Thanks for those quick insights, and also great to benefit from experience in supporting many other countries in Africa. Stanfield, so you worked obviously extensively in Zambia, but you're also a master trainer. Your thoughts?
Yeah, thank you so much. I like the title of this particular paper, in the trenches. I think it ably describes what is happening in Zambia. Because when you look at Zambia, the volunteers at community level, these form the bedrock of social assistance. Before 2000, yes, we had volunteers, but they were not structured. So it was only after 2000 that we formed these community welfare assistance committees. So they do a lot of work actually on the ground, especially pertaining to targeting issues of identification, witnessing payments, and also monitoring. And associated with the workload that is placed on them, there are always issue of remuneration. And therefore, one would ask to say, what kind of remuneration do they get? Yes, we give them bicycles, we give them T-shirts, and sometimes we give them a bit of stipends for witnessing payments. So when you talk to them to say, why do you do this work? Usually the first thing that comes out of their mouth is to say they do it for altruistic reasons. They gain satisfaction in ensuring that the less privileged in their community are able to be linked and get transfers from social protection. There is also some form of selfish reason in terms of the benefits that accrue to them, which are intangible. And this is because they say it raises their profile at a community level, because they are known, this is the chairperson, this is the secretary, this is the treasurer. So they think, yeah, it's important that they should continue doing it. Then one of the challenges that we have seen is the digitalization of payments in Zambia. In December, when I took some field work, we discovered to say there were these complaints from some of the beneficiaries getting their money through mobile payments, that it had resulted in a lack of a human touch, which was being experienced when you're doing manual payment. Of course, the money simply just comes to your phone and you receive the money, and there is no one basically to talk to, and they felt like we are making the program too digital and removing the human touch. Yeah, thank you.
Thank you, Stanfield, for also detailing a little bit, the experiences, that aspect of altruism or doing it for the love of your community, which we saw in several other countries as well, and raising digitalization as also a potential complexity. I'll pass over now to Judith. So Judith, you obviously worked extensively on the PSNP as well as other countries in Africa. Some of your thoughts, please.
Thank you. No, very important and rich topic, and so many different directions in which this conversation could go. So my mind is slightly blowing in different directions. Just specifically reflecting on Ethiopia experience, in some ways on this presentation, it actually looks like Ethiopia has quite a big workforce engaged with so many DAs, and while it may be insufficient, a 1 to 350 ratio probably looks quite good when compared to other countries, and particularly when they're categorized as professionals, and DAs are to some extent professionals, but they're not professionals in cash transfer provision. They're professionals in crop and livestock extension or in natural resource management. And this is an add-on task to an already full and busy workload. There's not a complete lack of logic in this. When PSNP was launched, Ministry of Agriculture was the only institution that really had a significant presence at the district level. But also the PSNP was always seen as a food security program, and it has a heavy public works component, with the majority of beneficiaries receiving their transfers in response to participating in community works. But all the same, there is this piggybacking that goes on, and in addition to this being a sort of blanket challenge, it produces a particular challenge whereby the ratios of DAs to Kabali is standardized. But if you're in a very poor area, you may have a very high PSNP caseload, but if you're in a better off area, you may only have a few beneficiaries. So suddenly that average of 350 beneficiaries per DA could actually be anything from 10 beneficiaries to a DA to 2,000 beneficiaries to a DA. And I think that is a particular challenge in some of the pastoral regions, where populations are much more spread out, staffing tends to be lower, and so even a greater challenge in providing services. I think it's another thing that's interesting to reflect on, and the thing I think we actually did quite right from the beginning, is separating out the role of the provision of cash transfers. At the time, there weren't opportunities of using third-party payment service providers, but the responsibility for cash transfers was within the Ministry of Finance, and was almost a separate channel of intervention. And I think that's produced better oversight of that area, but also slightly demarcated those roles. I think there's a very interesting thing around committees, and this in some ways abuse of people's time, as if if their time, it doesn't matter and isn't important. And I often worry about how every single project develops its own community committee structure. And on the one hand, while that participation is extremely valuable, on the other hand, I think there can be a lack of respect to the other demands that people have on their time. But I think it's also interesting to note that in a number of projects that I've seen, and that's both Ethiopia and Kenya, that reliance on committees doesn't just happen at community level. It can also happen at the other levels of structure, and is perhaps a sign of perhaps a poor analysis of roles and responsibilities. And rather than being clear about who is responsible for delivering and making decisions, you make a committee structure responsible. And actually, committees are often quite bad at making decisions. They can be quite good at rubber stamping things, but if you want good decision making, you actually need a clearer definition of roles and responsibilities. I'm sure I've exceeded my 3 minutes. Thank you.
Luckily, you borrowed a bit from Selwyn, so it's fine. Thank you, Judith, and really that point on the committees is really valuable, right? So yes, authenticity, approval, popular buy-in, but burden on time, and are you getting a professionalized, entitlement-based, by-the-book service, or is it really just going to be whatever it is? I'm going to move on to Celine. Celine, you're at UNICEF headquarters, but you've obviously worked extensively in Africa. Would you like to? Oh, actually, I have you first, right? Yeah, sorry. Let me go. You. So the Global Social Service Workforce Alliance has been looking at this quite a bit in the Asia Pacific region. You yourself have been writing a bit on this. Your reflections, please.
Yeah, thank you so much. And it's really fascinating. And it's actually the first chance we've had to join an event like this. And to see it for the Africa region is wonderful, because I think there's a really strong need, as well as a huge acceleration in programs like these. We tend to work more in the social welfare space with the social service workforce, as mentioned. So a big challenge for us is bridging the gap with the other actors who are responsible more for social protection systems. And even within UNICEF, we have who we often work with, they tend to have their own gaps between social policy and child protection, as many of you know. We're actually working in Iraq right now, where one of the biggest challenges is as much to get the different ministries cooperating on this at national level, to get UNICEF to really cooperate on this across their 2 divisions. I'm sure it's writ large in other organizations too. And I think, as some people mentioned, some of the big international organizations just seem to roll out programs and sometimes the technology for the programs, and they just forget the human factor. They don't think through the workforce, or they think, well, we'll just we'll budget for some, 1,000 volunteers and they'll get T-shirts and they'll get, it's just a kind of mechanistic. It doesn't think in terms of sustainable human resource development over time. So it's good to see these points being raised. Just a few very quick thoughts for me. In terms of numbers, I think it is a difficult numbers game. When we talk about a social worker or someone like a social worker, a parasocial worker, typically working with tens of cases at most to do a proper job, looking at quite complex and sensitive issues. But someone dealing with cash would probably be looking at hundreds up to 1,000 cases. So to then expect one person to do both types of job would be like one person being a vaccination nurse and also a brain surgeon at the same time. We wouldn't do that with a health workforce, but why do we sometimes, leverage those contradictory tasks into the people who have a social welfare role? But as the study identified at the very bottom of the community level, it's inevitable that there will be overlap and multitasking, because you might just have one community head, might be a volunteer or might be a community, and they inevitably have to look at everything from grain distribution to livelihood issues, and they may look at cash distribution, and they may also be at least signposting, them identifying the need. Like Rwanda, for example, has this well-known Izu, I can't remember the exact Kirwandis, but it's the male and female volunteers in each village. They're supposed to they're not supposed to actually do case management in depth, but they're supposed to identify and refer. So I think those are the key things that we need to look at the local level. If they are multitasking, have they the capacity to genuinely identify and then refer? And we've found in Iraq recently that there's often cultural sensitivity about identification. Like if it's a male workforce doing home visits, they won't get a chance to speak to the female members of the household, let alone actually wanting to ask those questions. They say we can't ask questions about violence and vulnerability because we have no answers to those questions. So we'd rather not ask those questions. So that's one challenge. It's not just saying you should identify a whole range of problems and refer. Well, actually they'll say, well, what are we going to then do? We could be opening a can of worms unless you train us and we have resources to back that up. So that's a point about identification. I think the point about referrals, everybody talks about, we should have them making referrals. But the thing about a referral is like, a good pass in football. It has to be both made and received. And many referrals are just made randomly, hoping that someone will pick it up. And the key thing is to have follow-up to make sure that the referral is picked up and it was beneficial. So we need training in how to actually coordinate referrals. I think the one thing that I think of, the thing about motivation is really interesting. We know that there are different and chaotic pay structures, and that can be demotivating for people when they're paid one moment and they're not, and it's sort of also humiliating if they're just paid through a t-shirt and so forth. I think it's also a risk. I mean, no one's talked about corruption, but I think corruption is a big risk when people are handling cash, and it's the question of how. Maybe nobody sets out being corrupt, but when they find over time that they have nothing going into their own pockets, it's either, okay, I'm going to continue do it pro bono out of the goodness of my heart, or actually I expect something for me, and I expect if I'm going to make your family registered for this and this, there is a small informal payment that I expect for that. So that's a risk that I think we need to be aware of, particularly when people are not paid, and that's as well as being a sustainability challenge. So I think trying to level these things up, trying to have much more coherence in organization, much more systemic approach would be greatly welcomed. That's all from me for now, but I'd love to participate in any further discussions. Thank you.
Thanks, Hugh. And I'll pass to Celine, but I'll also ask, some of the panelists afterwards, if you have some questions or observations to each other, we'll open up the floor after Celine speaks. Celine, go ahead.
Thank you, Vincent. And I think there has been already some discussion also and reflection. Just first of all, I would like to join my colleagues to commend this important piece of work with the study. I think it's timely, very timely, because just acknowledging the importance of this issue and where we are and recognizing the role of the social service workforce as a backbone of the social protection system. We have been talking about the importance of providing support in an integrated manner and the key role that the social service workforce has to play on that. I think Selwyn earlier also mentioned the importance of the effectiveness of the system, and I think there was Selwyn, you were mentioning the percentage of budget that is wasted in terms of not getting to the people. And we know here that the social service workforce has a key role to play. So again, this is an investment, and in a period of constrained budget, with the recognized role of social protection to address poverty, to address the issues, but also to make the system more effective, I think it's very much an important point. Just to reflect quickly on UNICEF role, and what UNICEF has been working along all of the experiences that you mentioned in the study and that colleagues have highlighted a bit more in the field, and working in support of the frontline workers of all types, all types that you mentioned. Yes, Hugh, definitely in UNICEF, the work on the social service workforce is, the objective is to have a joint effort between child protection and social protection. And while we are acknowledging sometimes for the system, the difficulty in bringing it together, it also happened internally, but really the idea is really to jointly support the social service workforce and strengthen the role of together with the strengthening of the role of community in health and nutrition. Two quick other points on this. I think I've seen in the comment, we see this as a relevant topic really across all of the context, including in fragile context. And I've seen Paul talking about what is happening, I believe, in Yemen and the work that has been done in Yemen. Vincent, in your new position, you were also talking about the relevance of this topic and to consider how to implement it in more fragile context, and also to take into account the gender lens. And I saw another question in the chat about that. And UNICEF is really working including in partnership with the World Bank on looking at how we can strengthen the social service workforce, including for social protection, to promote girls in poverty. Just to reflect on the next steps and what you see based on your recommendation, I think I would just want to highlight and echo three points that were already mentioned by colleagues. I think the first one is really the importance to look at the issue from a network and system perspective and not in silos, as just mentioned by Hugh. We acknowledge that at the front line, a specific social protection workforce doesn't exist, and we've heard a lot of examples. Judith was just highlighting that is often an add-on task for many workers. So it's really the importance of looking at it in a joint manner, and the importance to have a clear understanding of the individual function of the social service workforce, including for social protection. A second point, I think we need to be clear on the investments that are needed. And you mentioned it, I think it's crucial to put the social service workforce and involved in social protection visible, not only at the implementation level, but also in the policies and in the budget. And I think this is a key step and a key part of the institutionalization exercise, and need to be clear on the results we expect from this investment and work backward to see what is needed really to achieve them. Is it around the working condition, investment in salaries, etc.? And maybe finally, I think that, and that's what for me, listening to colleagues come out strongly, is really the importance of a people-centered approach. See what is most needed and start from what is already in place. So I believe in many cases is taking really the social service workforce in place that you described really well across the tiers and as well as the committee, and take that as a starting point to really see how we can build a workforce that can also handle social protection responsibility and make the necessary cross-cutting connection, acknowledging that won't be no one size fits all, I can say
one size fits all.
No one size fits all approach. And I think you kept talking about the outlier, for instance, of South Africa, but really just to start from there and see how we can best serve the people. Over.
Thanks, Celine. So it is open for some reflections, and I'd probably pass it over also to some of our earlier speakers. But some of the points you raise also resonate with what I see coming out of the chat and the Q&A around this question of how is it better to have a highly institutionalized approach? Should we all be pursuing the South Africa model, so to speak? Or are just countries going to find ways that don't necessarily fit within sort of the Western blueprint of social protection, where you have individualized entitlements and the state supports you based on your specific condition, but you rather have this sort of reliance on traditional community safety nets and mutual support systems? So in that question of institutional versus traditional, it also has to do a little bit with how countries are structured and what norms are in those countries. But then the question is, if you want a not one size fits all approach, and if you're going to more integrated models like one-stop shops or community integrated centers, then you do need to ensure that a certain level of professionalization and referral and counter referral and closing of cases takes place, right? So there is that tension, but obviously one comes with a cost financially versus to society and politically. So that's just a reflection I have at this point. But maybe I pass it over to Selwyn or Stanfield or Judith for some thoughts from your end.
Maybe just sort of quick interjections. I think something very important has come out from Paul's or the use input is that, you know, most of these institutions, again, having gone around, starts often with professionals. And I think, Vincent, we may want to, for the purpose of your study, define what is meant by a professional career or position, because many of the people who we call professionals are those social workers or people with qualifications, degree and post, and who are also members of some or other institution. And as I said, many of them seem to have been involved in the beginning of establishing the systems. I think it started in South Africa also like that, social workers. But since 94, we brought in people with different skill sets for two reasons. One is it's quite inefficient to use a professional to process papers and documentations and to verify it. So there is a need, in a sense, to separate these two functions of processing an application, verifying it, and then ensuring the approval of payments. Again, given and this is where I should say the new systems, we South Africans, that we started with all these intense processes with people handling documents. Many of the systems now start off with digitization, as we have seen, and so that is an advantage. But as one goes forward, we need a different person with a different sets of skills as institutions grow. And we may want to then think of, you know, what is it that we deem as a professional for the position or a person with a specialized skills. And to this extent, quite a number of years ago already, we developed a curriculum and a certified qualification for people at this level to separate them from your more managerial professions and make things different. On the technology issue, I think it's going to help us quite a bit with the issues of accessibility. So that when people go out in the rural areas, such as what we have done in many jurisdictions, that you can actually use the technology as well as create accessibility to those additional services like case management, like family interventions. And of course, another interesting thing that where South Africa is lagging behind, which we have seen in Liberia and Ghana, is the linkages to other services in addition to just the cash benefit, such as support services of an entrepreneurial nature. On my last point now, coming from Celine, you've raised a number of very good questions, and again, some of those will take time to digest and to discuss around it. And surely those are points you may want to throw in, because I think also for the donor agencies, things are going to change. And I've noticed the trend over the last 2 to 3 years, and I may be wrong, a kind of disinvestment, if you wish, into social protection and cash transfers and more into education. And while that may be very good from a social protection point of view and building human capacity, one fears the neglecting of building institutions, building the necessary capacity in these social security institutions. And then to conclude, I think on this point is that, and again, the response to Celine is in the planning, it would be good to look at the trajectory of growth. And here, if I look at what's happening on the continent, is a process of transitioning from donor ownership, so to speak, to government, because ultimately that is where it's going to be a lot more effective. And one understands, of course, the governance and accountability and transparency and corruption challenges in many jurisdictions. But there will be a need ultimately to try and begin to build this capacity within government, but also to agree on a plan of transition towards it. So I think those are some of the considerations that needs to go into it. Thanks for now, Vincent.
Yeah, thanks, Selwyn. So some reflections. Stanfield, do you have some thoughts coming from the Zambia perspective? Also on digitization,
Yep.
It keeps coming up as a topic, and you raised it yourself. So.
Yeah, maybe before talking about that, I think the critical issue is to say, how do we sustain volunteerism in Zambia? Of course, definitely for us, since most of the population is rural, and we are depending on these community networks, social capital, for us to deliver various programs and social protection, social assistance. So we need to find ways of sustaining this good way. We cannot take it for granted. I think one of the things we should be exploring is to say, how do we reduce the workload? Is there some business processes that could be done differently so that we don't take too much of their personal time? I think that is also important. Last month, there are now some thoughts around to say, how can we ensure that we give them some structured capacity building around the grievance redress mechanisms, for instance, and also issues around the case management, because these are the tools that they need for them to be effective frontline workers. About digitalization, I think in the Zambian case, because I think we are just moving towards that, especially that it's now national policy that we have to ensure that as much as possible all government programs are delivered using digital means. I think we need to do a study to compare the don'ts and the advantages and disadvantages of digitalization. Of course, there are a lot of cases we are seeing them now where beneficiaries basically are being exploited by family members, and this usually pertains to older persons. A grandmother, 70 years, 80 years, the literacy levels are low, so they are depending on the grandchild to kind of check whether the cash transfer has hit their mobile money account, and this grandchild simply says, no, there is no money. And he goes and transfers the money from the grandma's phone to his phone or to a friend's phone, and the money is gone. You'll see after 10 months, the grandmother comes to complain to say, I've not been paid for the past 6 months. And you look in the system, your system is telling you that actually the money has been paid. So one would want to think that the fact that in your system it shows that the money has been dispensed might not mean that actually on the ground the money has reached the beneficiary. I think we need to do a bit of work around that. Yeah, thank you.
Yeah, thanks. And that starts bringing in those issues of the trusting in digital processes, and then, at the expense potentially of the client interface aspects, which I think you've brought up a few times as well. And maybe in a bit you can come in on that. Jude, did you have any quick thoughts?
I was just thinking a little bit about this issue of kind of professionalization, and I think as Selwyn alluded to, there are some tasks that professionalization really brings added value to, and there are other things that are actually don't overcomplicate it and make something too expensive, and working out that balance is important. Another thing, working and the productive rural safety net is largely in rural areas, and there is a reality of it being very difficult to recruit and retain qualified staff to work remotely. And so expecting too high a level of professionalization below a Warada level, I mean, even at a Warada level, is sort of beyond expectation, however much money you throw at it, to some extent, because people will not want to work in such remote areas. But actually, as a sort of potential way out of that, one of the things that I think is worth thinking through is about how is career progression, and that people can very usefully do 2-3 years experience at a very low level if they know it's a stepping stone to living somewhere more acceptable, particularly as they get older, start having kids, want kids to have healthcare and good schools. So thinking about how some of these remoter, more rural jobs are good ways of going into career progression. But I just also think back to Ethiopia and the fact, as Selwyn says, we're trying to get these systematically within government, and yet these governments do not have money lying around. And so I don't have the answers, but there's a really important set of questions around how do we invest really smartly to get the best bang for our buck in all of this.
Yeah, okay. Hugo, I'll pass it back to you. Do you have any thoughts?
Yeah, just two very quick points. So it's great that Judith raised this issue about the urban-rural differences, because there is an irony in the work on ratios. So we've been doing some guidance, we've developed some global guidance on ratios, and we're recognizing that with the increased distances involved and the time involved in serving a rural population, particularly if you're a home visitor, you know, if your job involves home visiting, which really it should do if it's social work or parasocial work, then you have to count in a lot more time. So you actually need more per population in rural areas, but tends to be that there are more per population in urban areas because that's where more staff are located. So that is a real dilemma and a contradiction. But I absolutely agree with Judith's point. It's incredibly hard to incentivize people into rural areas. You know, communist countries used to do it by giving people like a special reward for being a teacher or a doctor in a village, but it was usually only for the first 5 years of their career. And it's really hard to build on that. So I do think that enabling community cadres more, and it's not necessarily a highly technical role, but it is the ethical safeguards, I think, are key. So that brings me to the other point, which also Karima mentioned in the Q&A, and others have mentioned about tech. And I've had dialogues with Gulf country governments recently saying, we want to recruit the top talent, respond to the needs of the market, and use AI. So they suddenly go in with this kind of language. Everything has to be shiny and wonderful. And I'm thinking, well, there's a risk there, because you could use AI in digital solutions, but we're talking about vulnerable people in vulnerable situations. And if you don't have the trust, the community networks, the human capacity, and the ethical safeguards, it could be an AI nightmare. You know what it's like when you want tech support for your computer, your phone, or from the bank, and it takes so long to get through to a human being. Now, imagine if you're a vulnerable person with limited language and limited tech skills, how hard it would be to get through to a human being when you have that kind of challenge that Stanfield mentioned, when your money is supposed to be coming, but it's not coming and you don't know why. Or you're facing domestic violence or coercive control from your partner. You know, that's a sensitive thing to explain, and you can't explain it to a chatbot. You know, so I do think we have to worry about technology is brilliant if it relieves time to humans to do the thing that humans do well. But it has to be really carefully managed so that it doesn't actually introduce a new problem. I think that's all from me. Thank you so much.
Thank you so much, Hugh. So there's a lot of rich content here. We only have about 10 minutes left in our webinar. And I'll pass it over to Celine, and then I would actually ask after that, because I think we've covered most of the questions in the Q&A. If something else comes up, we'll try and address it. But then I asked maybe to then after Celine, if you could pass it on to Paul, who's in the regional office of UNICEF in West Africa, And he's been one of the people working on this topic quite extensively as well, and one of the few people I've seen calling for more research on this topic in public spheres. So I'd ask him to do then some wrap up. But Celine, over to you.
Thanks, and I'll be very brief. I wanted just to add quickly on the point around professionalization and about the next step. I think there is a risk here I think it's great that we put it on the agenda, but there is this risk of saying we are talking about really putting a focus on that, and it means professionalizing everything. I think we have discussed, the value of the committees, the risks that come with it. I can't remember which colleague mentioned potential corruption, potential issues, and the way they are being handled. But I think in terms of community workers giving that time, there is also this value of contributing to the system that really need to be acknowledged. And I think our role is it's crucial to see what is the framework that we need to provide to ensure progression, to ensure recognition, to look at the ratios and not in a blanket manner. And maybe the second point, I think we are talking about the importance of research, but I saw Valentina's comment about how do we track this work. We acknowledge the no one-size-fits-all approach. We acknowledge the different trajectories, and we know that we cannot do without an expanded role of the social service workforce to accompany the cash transfer expansion and strengthening of the system as a whole. So I think as we are all together today, I think it's going to be important to start thinking how to monitor and what are the key things we look at that cannot be only numbers of social workers dedicated to social protection, etc. But how do we look at the monitoring and of the advancement of this topic to make sure to help us track and make sure we are on track. And on this, I'll hand over to my colleague Paul for more of his insights from the Africa region and on the overall topic as a whole.
Thank you, Celine. And thanks for the opportunity to say a few words at the end of this incredibly inspiring webinar. And thank you, Vincent, Avanti, and thanks to the panelists. Really very deep and great insights shared. And I'm sure the audience has been inspired as well. Just a few words, at the risk of repeating a few things. First, I want to get back to what was said at the very outset of this webinar. Social protection, in particular non-contributory social protection, is actually a very young sector in Africa. It's only over the past 10 to 15 years that we have seen a rise in the number and coverage of non-contributory programs, in particular national cash transfer programs. It has only been over the past 10, 15 years that many countries have equipped themselves with social protection policies or strategies, that they have come up with better coordination platforms, that they have established social registries, that have started to strengthen their delivery systems. And the webinar was organized under the banner of Transform, and Transform has been trying to accompany this system strengthening agenda. But I think we have to be very honest to say that in all these developments, we have overlooked the workforce that is needed there to deliver on all those ambitions. And I dare say we have overlooked the people that Stanfield mentioned in the trenches, delivering the services to vulnerable groups, and that are indispensable for us to live up to those ambitions and for countries to live up to those ambitions. So Vincent, Avanti, great work in trying to unpack the issues. I really appreciated the way you structured your analysis, giving us insights about the types of cadres we talked about, the different levels in public administration where they work, the issues of ratios. What really struck me was the variety between countries. You looked into like 10, 12 countries. We have many more. And I think the variety is only increasing. And for me, that really necessitates us to put the emphasis on contextualized national discussions. What are the cadres we're talking about in our country? Volunteers, professionals, and only then start to talk about a strengthening agenda. Because that is what we need. I strongly believe that for the ambition we have for social protection, non-contributory social protection in particular, we need to strengthen the workforce. And the term, inevitably, sorry, Vincent, for me is institutionalization. I only know of very few national social protection policies or strategies that tackle human resource issues. So can we find entry points to help countries to establish a human resource strategy for social protection? What cadres do we have? What are the ratios? What do we need to expand the workforce? What do we need to deepen the workforce? Because these are the two arms of the discussions I think that I've seen emerging in this webinar. How do we link the social protection cadres to other cadres working at community level? In UNICEF, there is a lot of emphasis on community health and nutrition workers. Sometimes functions are very closely related to the services they deliver for social protection programs or for protection programs. So policy frameworks, human resource strategies. Then another piece that really came out of the panel discussions is about capacity. Now, what are the job profiles that we need to deliver on those ambitions? What are the competencies we need? How do we work on career development, professionalization? And I really think one direction is to work much more strongly with the established national training institutions and schools that prepare cadres to start working in the trenches. The schools of social work. There are a couple of countries in Africa. There's ongoing work to integrate social protection much more in the curricula for social work. Judith mentioned one very important issue that I hear often coming up, and that is the fear for overloading people with too many responsibilities. And that's a very important issue. And so deepening cannot come without strengthening. And in that case, Stanfield, I think Zambia has been a good example where 10 years ago, when the cash transfer was progressively rolled out to new districts, every new district receiving the cash transfer program received one additional social welfare officer. So in that sense, it was an opportunity. Now the rise of social protection to expand the workforce, the social welfare workforce in the case of Zambia. So that's about capacity, the frameworks, capacity, and the last element is money. I think it came up in the chat as well. Everything comes at a cost, but I think we need to have country-specific strategies to find ways for the public sector also to invest in a broader and deeper workforce. And countries in Africa, we know, are in difficult fiscal positions these days. And some international organizations are very critically looking at the wage bill in those countries. But how can we organize ourselves to enter that dialogue and to protect, if not expand, part of that wage bill that is focused on frontline service workers and even volunteers? I strongly believe in that. So these were my main points. I think an interesting discussion came up in the chat. That's maybe a frontier area. So what about the social protection workforce when it comes to responding to shocks, maintaining services, expanding services? And what about the social protection workforce in humanitarian situations? So I think that is an area maybe for future discussion. As Transform, I dare say that Transform remains committed to see how to better integrate the topic of workforce strengthening for social protection in its broader curriculum for social protection systems in Africa. That's all, just a few remarks out of excitement for the topic, and grateful to the panel members and you, Vincent and Avanti, for bringing this again very prominently on the agenda. Thank you.
Thank you so much, Paul. And with this, we're glad to say we're right on time to end this session. We would like to take this opportunity to really thank socialprotection.org for giving us a platform to make this webinar possible. Big thank you to also Transform that is hosting this webinar. To all the panelists who've been here today to enrich the discussions. Big thank you to our key informants, some of whom hopefully were able to join this call, and others who continue to support in the background. Our co-collaborators, including Celine, Paul, our upcoming co-author Valentina, and everybody else who's taking this field forward. Thank you so much for attending today. The recording and slides will be, I believe, shared via email to all those who have registered. So thank you once again, and have a nice day.
Thank you, everyone.
Thank you, guys.